I think somebody mentioned that this workforce plan was first raised by Jeremy Hunt over 5 years ago. We've been hearing from the current administration here that the workforce plan would be issued since January, but it's here. It was published about 15 minutes ago, 151 pages, adding more detail to what we know already, Samantha, about those tens of thousands of extra training places for doctors, nurses and other healthcare professionals. We've been poring over some of the key numbers here, and I'll go through some of them. And essentially what this plan does, it is to grow the workforce, to retrain the workforce where it needs to with the addition of extra technology, and essentially to retain that workforce. The government wants to work towards a plan over the next 5, 10 and 15 years where it is less dependent on overseas trained health professionals. And they have given us in their modelling and data the sort of projections over the next few years. But essentially what this means is that we won't see the benefits of this long-term workforce plan in the short term. And it won't do anything to address things like social care or NHS estates. But certainly there has been almost a universal welcome for this workforce plan from everyone, the experts in health and tech and the think tanks as well. 60,000 more doctors, 170,000 more nurses, 71,000 more allied health professionals, aim to retain 130 extra staff. So that would be an extra 431,000 staff by 2031. That's an increase of 34%. Almost a quarter of NHS staff will be trained via apprenticeship by 2031-32, and medical degree apprenticeships, 2,000 to be trained by 2031-32. That is, the idea is to train more NHS staff domestically. So in 15 years' time, we can expect around 9 to 10% of our workforce to be recruited from overseas, compared to nearly a quarter right now. They'll also be encouraging retired doctors to come back to the NHS, and they've announced support staff for the NHS as well. And this is why they're doing this, because we have an aging and complex aging population with complex health needs. The workforce has shrunk in real terms when you consider the amount of patients they have to see. Over the next 15 years, the population of England is projected to increase by 4.2%, but the number of people aged over 85 will grow by 55%. And these people will have complex health needs which need care. And at the moment, the NHS is, as we all know, struggling to cope. The idea is to grow the workforce over the next 5, 10, 15 years so it can meet the demands of a growing and aging population.